Hello and welcome to my health channel. I want to talk about stroke today simply because it's now a serious and life-threatening medical condition. It is a medical condition in which poor blood flow to the brain and then causes the cell to die. It occurs when blood supply to the brain is cut off. The brain is what controls what we all do and who we all are. When someone gets or has stroke, part of this or part of who we all are gets shut down. Okay, 100,000 people is documented to have stroke in United Kingdom every year. It has become the most common cause of death today. It can happen at any time to anyone. It has now become a medical emergency. Stroke is not just an adult condition. It can happen at any age. It is documented that there is over 400,000 childhood strokes a year in the United Kingdom, and this affects babies in the womb, children, and young people. It must be clearly noted that strokes in children are different from those in adults. I have to state here that 85% are caused by a blockage and 15% are caused by a bleed in the brain. For the purpose of this video, I'm clearly going to be talking about strokes in adults only. So as we age, our arteries become thicker and narrower and may end up becoming blocked. We know that certain medical conditions can speed it up or speed up the process and increase the risk of stroke. Stroke is a brain attack. It happens when one's brain loses blood supply. It happens when blood supply to the part of the brain is cut off. This can cause brain damage, long-term disability, or even death. Now, what are the stroke signs? Well, it can range from mild weakness to paralysis or numbness of one side of the body or face. Often this affects one side of the body. One side of the mouth may droop when you attempt to smile. There can be sudden or severe headaches, which may be accompanied by vomiting, dizziness, altered consciousness. There might be trouble speaking and understanding what other people are saying. It does come with confusion, slow words, and may have difficulty to understand speech and what is being said. Some people have problems with seeing in one eye or both eyes. Things might get blurred or may have blackened vision in one or both eyes, or people may begin to see double. Some have trouble walking, may stumble and lose balance, may have some dizziness and loss of coordination. Okay, so when people are having signs of stroke, it is good to think about the word fast. Fast means you have to look at the person's face, you have to look at the person's arm, you have to look at the person's speech, and time is essential. Time is very important, okay? So if you live in a developed world, please call the ambulance services immediately. And if you live in a developing world and you don't have good ambulance services, please take this patient to the hospital right away. A stitch in time saves 9, okay? Now let's look at what causes stroke. Our brain needs oxygen and nutrients provided by blood to function. Once blood supply is restricted and stopped, the brain cells begin to die. This can lead to brain injury, disability, and death. There are 3 main causes of strokes. One is the ischemic stroke. This is where the blood supply is stopped because of blood clots. Blood clots reduce the flow of blood to the brain, causing blockages. This accounts to 85% of cases. The next one is called the hemorrhagic stroke. This is where a weakened blood vessel supplying blood to the brain bursts. And then we have the transient ischemic attack, which is often referred to as the TIA. Some people call it the mini stroke. It can last from a few minutes or persist up to 24 hours. This happens when the blockage stops the blood getting to your brain and is temporary. TIAs are basically a warning sign that the person is at risk of having a full stroke in the near future. Okay, and now we're going to look at the conditions that increases the risk of stroke. High blood pressure, as we all know, is one of them. If you have high blood pressure, please stick to your medications, take them on a daily basis. If you have undiagnosed blood pressure and you need to be put on medication, you need to speak to a doctor so they can decide which of the blood pressure medications to give you or prescribe. Okay, now you can't take the law into your hands. Your BP, if it's high, has to be managed. Okay, if you don't manage it, you are at a risk of having stroke. Now, I did mention in one of my videos about routine blood tests, and cholesterol blood test is one of the routine blood tests, and it's recommended to have it at least once a year. Okay, now, if you have high cholesterol, you are at a risk of getting stroke. Okay, and the only way to lower this is by eating healthily and getting more exercise. See your doctor in case you need to be put on medication after your blood test. Okay, don't overlook this, because if you do, you're at a increased risk of getting stroke. Now I'm going to talk about the irregular heartbeats. Okay, normal heartbeat is 60 to 80 beats per minute. Okay, if your heartbeat is over 100, then it needs to be monitored. Okay, if you already have atrial fibrillation, okay, which is a heart condition that causes irregular heartbeats, then you need to be monitored on a serious note. Okay, because if you don't, you're at a high risk of getting stroke. Diabetes is another high risk condition. If you have diabetes, stay on your medications, do your follow-ups with your doctor, go for yearly reviews. Okay, take your medications as prescribed. Change your lifestyle to include your diet and exercise and lose some weight. Okay, watch your sugar intake. Keep an eye on your sugar intake. Eat healthily and have regular exercise. Now, how is stroke diagnosed? Now, when you have all the symptoms I've mentioned and you go into hospital, the first thing they will do is to do a blood test to check for your sugar and cholesterol. Okay, then they will check your pulse rates for irregular heartbeats. They will check your blood pressure as well. Okay, now after that, they might decide to do a brain scan, because the brain scans will determine if the stroke has been caused by blocked artery, which we call ischemic stroke, or whether it's a burst blood vessel, which is called hemorrhagic stroke. And they want to know which part of the brain is affected and how severe the stroke is. Okay, they might decide to go for scans. The two main scans are the CT scans and the MRI scans. Okay, they might decide to do they would decide to do a swallow test. Swallow test is to determine if you're swallowing and your swallow is affected. Okay, they might have what they call the carotid ultrasound and echocardiography as well. Okay, now we know that effective treatment of stroke can prevent long-term disability and save lives. Treatments will depend on the type of stroke, whether it's caused by blocking of the blood supply to the brain, ischemic, or bleeding in and around the brain, hemorrhagic. Usually, treatment involves one or more medicines. We know some people may need surgery. If one has the blockage, if one has the blockage, combination of medicines to treat this condition and prevent it from happening again is recommended. These medicines can be taken immediately and only for a short while the other medicines may be started once stroke has been treated and may be taken long term. Once at the hospital, patients with ischemic stroke may have an emergency procedure, thrombectomy, to remove blood clots and help restore blood flow to the brain. People are put on aspirin or other antiplatelets. Most people will be offered regular dose of aspirin, which reduces the chances of another blood clot. Anticoagulants, some people may be offered anticoagulants to help reduce the risk of developing new blood clots in future. Anticoagulants include warfarin, apixaban, rivaroxaban. Okay, if blood pressure is too high, patients may need to be offered drugs to lower it. They can get things like diuretics, suitable blood pressure lowering medications like beta blockers, alpha and calcium channel blockers, ACE inhibitors. Your doctor will decide what to prescribe. If level of cholesterol is high, a patient may be offered statin to help reduce the level of cholesterol in the blood. The doctors may offer statin even if cholesterol is not high. as it may reduce the risk of stroke. Okay, there are other additional treatments that the doctor may consider. Okay, I will stop so far at this point because I feel this is what you need to know at this point. Okay, if you get into the hospital and they want to offer other further treatments, they will advise you. Now, the only way, best way to prevent stroke is to eat healthily and exercise regularly. These lifestyle changes can reduce the risk of having another stroke. A low-fat, high-fiber diet is usually recommended, plus plenty of fruit, fresh fruits and vegetables. Cut down on foods high in salt and processed foods. If you're smoking, stop now. Smoking narrows your arteries and makes your blood more likely to clot. If you drink, cut down on alcohol consumption, as it can lead to high blood pressure and trigger an irregular heartbeat, both of which can increase the risk of having a stroke. Lifestyle changes can help control underlying conditions to a larger degree, and if you are on a regular medication, continue to take it, please. Okay, now I want to go back to the fast thing. Okay, it is very important that when somebody is having stroke, you look at their face, you look at the face, you look at their arm, you look at the speech, and you look at time. Time is important. Okay, so once somebody has all these symptoms, please, if you're in a developing world, please rush the person to the hospital. If you haven't got good ambulance services, if you're in a developed world, call the ambulance services right away. They will know what to do and fetch the person to the hospital, please. It is very, very important. Okay, there are foods that prevent stroke. If you look on the screen, you will see what you can eat to prevent stroke. Okay, it's very, very important. Okay, it's very, very important that we take our medications. Okay, if they're prescribed, okay, and then we don't skip any of medications or decide to take it when we like. Okay, if you take your medications, you are going to help yourself, then you won't have much risk of picking up stroke. Okay, but if you don't take your medications, you leave yourself at high risk, and that's not good. So we must do everything to prevent getting stroke as much as possible. Okay, go to the hospitals, do your blood tests, check your blood pressure all the time, check your heart rate. If you have anything happening to you, speak to the doctor. Okay, don't overlook any of these signs and symptoms. They're very, very important that you know them. Okay, study them. Let people around you know what the signs and symptoms are, especially if you're already at high risk of picking up these problems. Okay, it's very, very important that we control our blood pressure at all times, quit smoking, and try and manage our lifestyle exercises, eating healthily, and knowing the signs is very important. Knowing the signs of stroke is very, very important, that we acquaint ourselves with the word fast. It's very, very important, rather than somebody having all these symptoms and people don't know what it's all about and it gets worse for the person. Okay, so I'm going to say at this point, thank you very much for watching my video. Okay, I hope you've learned something from it. Share it to your friends and family. It's very, very important that they have it and they study it and know all the signs and symptoms. Okay, because it's going to help each and every one of us if we get any of the symptoms or signs. Subscribe and share to your friends. Thank you for watching once again.